Hello everyone, I am Dr. Prachi Kulkarni, fertility consultant, 49 Fertility Center. Today I am going to talk about fallopian tubes. What are fallopian tubes? What is their function? What tests are done to check if the tubes are open or not? And what is the treatment if the fallopian tubes are blocked? So, I have got a specimen here. This is the uterus. These are the fallopian tubes. So, fallopian tubes are very fine structures which are connected to the uterus, and they are hanging, the distal end of the tube is hanging freely over the ovaries. They are about 10 centimeters to 13 centimeters in length. The main function is to pick up the egg once it is released from the ovary. And the fallopian tubes are important because this is the place in the body where the egg and sperm meet. So the fertilization happens in the fallopian tube. So for that purpose, the fallopian tube has a very fine hair-like structure called cilia, which are lining the inside of the tube. Those cilia, with the movement, they make the egg to come inside the tube. Also, those same cilia will help the movement of the embryo or transport of the embryo from the tube to the uterus. So function of the fallopian tube is to make the egg and give the optimal conditions for the egg and sperm to mate in the body, transport of the egg and transport of the embryo from the tube to the uterus. So the pregnancy should come to the uterus and get implanted inside the uterus. So what should be the test which we should be looking at to check the function or the patency of the fallopian tubes? So there is no test which will exactly tell us about the functioning of the tubes, but the tests which are conducted will tell us about the patency of the tubes, means if the tubes are open or not. So these tests are mainly HSG or hysterosalpingogram, then SSG or saline salpingogram or HycoC. Third test could be a diagnostic laparoscopy where they push in the dye and check it by putting in the camera in your abdomen to see if the dye is coming out of the tubes. So these are the ways to check the fallopian tubes. So usually diagnostic laparoscopy is not considered nowadays because there are better tests available, and the surgery is an invasive procedure which requires anesthesia. So usually SSG or HSG are the tests which are preferred to diagnose the patency of the tubes. So when should you get a tubal test done? Suppose if you are young, less than 30 years of age, you are married recently, you have tried naturally for 1 or 2 years, then it is the time that you should get your fallopian tubes tested. If your age is on the higher side, or on the ultrasound, if the doctor is suspecting any pelvic infection disease or any adhesions in that case, or endometriosis or tuberculosis, pelvic tuberculosis, genital tuberculosis, in that case you should go for these tests earlier. So HSG or SSG will let us know if the tubes are open or not, which means that this tract is open. So if the tubes are open, then you have to also consider other factors like how the husband's semen parameters are, and how are your antral follicle count or your egg reserve test, which are AMH and second day FSH, LH hormone levels. Based on all these reports, your doctor can suggest you what treatment you can go for. So if the tubes are open and other things are favorable, you may consider going for an IUI, where the chances of success should be somewhere around 15 to 20%. If the tubes are blocked, then there are again two options. The reason why the tubes are blocked also will determine the treatment which you should consider. So in case of blocked tubes, you should consult a good fertility specialist who can discuss with you in detail about the options, which can be either tubal reconstructive surgery or IVF. The IVF was first started for the patient who was having blocked fallopian tubes. So this is the treatment of choice for blocked fallopian tubes. If your egg reserve is on borderline or on the lower side, or if your age is more than 35 years of age, where the chances of conceiving naturally after opening the tubes might be on the lower side, or if your tubal conditions are not such that the chances of reconstruction are better, so in that case your doctor may suggest you to go directly for an IVF. So in IVF, what happens is, we after stimulating the ovaries, we take out the eggs outside the body, and the egg and sperm need not meet in the body. So the function of the tube, which was transporting the egg and transporting the embryo and giving the favorable condition for egg and sperm to meet in the body, is everything is done outside in an IVF cycle. After maturing the eggs, we take out the eggs, we make the egg and sperm meet outside the body by ICSI. We keep your embryos in the favorable condition, in the good culture media, in the incubators. We grow the embryos till the day 5 or day 6, that is blastocyst stage, which is the same embryo which is dropping from the fallopian tube into the uterus when you conceive naturally. So if the tubes are blocked, your age is on the higher side, and if your reserve is borderline, or if there are any other coexistent conditions like your husband's semen parameters are not very favorable, you have multiple medical conditions or other conditions which may make you take the decision for IVF, then IVF would be the best treatment in case of blocked fallopian tubes. Thank you.